Okay, so I'm going to show you some great exercises for DeQuervain's, stenosing tenosynovitis. That's where your wrist tendons here on the thumb side become incredibly painful. So first of all, you have to know that it's an incredibly brutal and stubborn and hard condition. So it may take a long time for this area to heal. And sometimes patients get cortisone shots, and sometimes if they choose to do that, it actually really helps. I wouldn't recommend doing more than one or two though, right? But DeQuervain's is a tough one. Nevertheless, here are two exercise techniques for it. The first is called a static hold. So you just spread out the fingers and you just hold that for about a minute. And you do that at least 3 sets for a minute, twice a day, okay? So 3 sets, 1 minute each rep, twice a day. So we're just holding that, we're spreading that. If you want to make it harder, you can use a band, okay? And you can spread out the band, okay? You can band it and you can do what's called a static hold, okay? So we're working on static hold. Then the second exercise that you can work on is something called an eccentric movement. So we are gently moving that thumb and that wrist out this way, away from the area of pain. That's called an eccentric movement. That actually kind of stretches the whole arm area and the elbow, and it strengthens those tendons at the same time. It's called an eccentric movement. What you don't want to do is you don't want to tweak the wrist too much or bend it too hard, okay? In my opinion, not very effective, and sometimes it injures it more. So the eccentric movement, about 3 sets of 30 a day, and the static hold. Now, what you can also work on doing is using a ball or your hand and just massaging out your elbow muscles, your forearm muscles, and even as far up as your back. You can also work on doing shoulder blade exercises to get that shoulder blade back in alignment, because sometimes shoulder issues can cause this as well, okay? So those are my recommendations for DeQuervain's.